Now we move on to a quick health update for you Plano folks.
Several instances of MRSA, MRSA, and let me see if I get this right, methicillin-resistant Staphylococcus aureus, a contagious bacterial infection, have been reported in the last few weeks in and around Plano.
MRSA is known in the medical community as something of a superbug because it's resistant to your everyday antibiotics. There is treatment available, but left to its own devices, MRSA could prove fatal. So we've taken a few minutes out of your daily programming tonight to help raise awareness about how to prevent contracting it and when to see a doctor.
That's right. MRSA is found both in the developed and developing world, but is more common in the developing. South Africa and Malaysia have the highest rates, but we shouldn't discount our own United States.
According to 2017 US data, about 119,000 reported contractions of MRSA. There were about 20,000 reported deaths, so it's imperative that you seek treatment if you believe you've been infected. Let's move to Medha, who is currently at a health clinic.
Thank you, Katya. I'm standing here with Dr. Srivastava, who's taken some time out of her day to explain the risk factors, symptoms, and treatment associated with MRSA.
Glad to be here of service. Thanks for having me, Medha.
No problem. So what can you tell us?
Well, the most important thing to note is that MRSA is a bacterial infection that's spread through direct contact, not the air.
Okay.
It's typically stored in your nasal cavity and across your skin and is transmitted through 4 regions: hands, soiled areas, discharge, and open wounds, which means that healthcare workers are the #1 conduit because they interact with patients who in those 4 regions on the daily.
It sounds like this is a pretty risky disease. What should we be on the lookout for?
Well, the trademark of MRSA is the red boil that starts out as a smaller red bump, grows larger and larger and fills with pus, and becomes painful right before rupture.
That sounds terrible.
It is, but to make matters worse, it's often accompanied with fever and swollen lymph nodes.
This is not a disease you want to get on the wrong side of, folks. Is there anything we can do to prevent contracting it?
Well, unfortunately, there is no vaccine if that's what you're asking. However, there's always preventative measures we can take, and rest assured, folks, the majority of us are not within those who are at risk for contracting MRSA.
Who are those people typically?
Well, it's anyone with a weakened immune system, which includes those who have injection sites from IV drips or catheters, anyone with an extreme skin condition, people who regularly take antibiotics, and anyone recovering from a recent surgery.
It sounds like that outside of a hospital setting, the rest of us aren't really at risk for MRSA.
Yes, typically not, but there are exceptions to that rule. If you interact with a lot of people on the daily, play a sport, have any kind of cut or abrasion, regularly inject drugs like insulin, and live in an area with low sanitation and high crowding, you're more at risk for contracting the disease.
This does not sound fun, folks. Is there anything that we can do to shield ourselves from contracting MRSA?
Right, those are the preventative measures I was talking about. They include washing your hands often, sneezing into your elbow, not your palm, avoiding sharing personal items like hairbrushes and lipstick, and making sure that you have short nails.
So, just so the rest of us aren't terrified every time we walk into a doctor's office, what should we expect from treatment plans?
Well, as soon as you exhibit symptoms, you should go to your doctor. They'll typically then assign you a 7 or 10-day oral antibiotic, or in very extreme cases, an intravenous option. However, once you're done with that, the disease typically goes away, and occasionally you may have your abscesses and boils surgically removed and be sent home with soaps and ointments that prevent recurring infection.
Is there anything you'd like to mention before we wrap up?
Yes, make sure that you finish your course of antibiotics, otherwise MRSA will become resistant to those as well and eventually become a superbug that can't be defeated and is deadly. Remember guys, getting treatment sooner rather than later is always good because it's less painful for us and for you.
Thank you for that, Dr. Srivastava. Have a great day.
Thanks for having me.
Let's go back to Haley and Katya.
Thank you for that informational update. And remember, if you believe you've contracted MRSA, go to a doctor's office immediately and inform your family of tonight's news broadcast.